You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis.
IMHO Talk Show is Charles, is Max, is Razor, is Aaron. And as promised, we are joined still by our partners at Seville Tomorrow, Giles, Elliot, and Jesse. And we also have added a friend of the show, no stranger, Miss Catherine Goodman from the Thomas Jefferson Area Health Department. Catherine, good to talk to you today.
Hey, great to be on and happy to talk with y'all.
Likewise. So, COVID, y'all. Like, where do you start, Aaron?
Corona.
Corona, getting real. But so I guess a glimmer of hope, right? A little good news is that, Jesse, as you reported, Charlottesville area becomes an island of low COVID cases while the rest of Virginia surges. Want you and Catherine to chime in on why that looks to be the case. As well as we're approaching Thanksgiving and we have this resurgence. There's new state restrictions. So So Jesse, how about we start with what you found with that report as far as Charlottesville, for some reason being the light spot in the state when it comes to the COVID resurgence.
Sure. Well, Catherine could probably talk about this in a lot more detail because she has her thumb on the pulse of all of the data out there. But with the public health people that I spoke to for that article, there's a lot of different ways to measure how we're all doing. And when you accumulate them all together, what I was hearing over and over again is Charlottesville is doing pretty well. It's doing really well compared to the rest of the state and therefore the rest of the country, because Virginia itself is doing pretty well compared to the rest of the country. Mm-hmm. And so, with that in mind, the question immediately in our minds was, well, why? Mm-hmm. And there's a lot that, Catherine will probably tell you nobody really knows. But the thing that really seems to be different about our area from other places is people here take the safety measures really seriously.
Good job, y'all. Good job.
Yeah.
I'm proud of you.
I don't know what people you talking to, Jesse, because I see a lot of people who
You live in Greene County, man.
That's right.
You be going to that Walmart dare I say.
People who
Well, I didn't realize really until I actually traveled out of our little area. I stayed in Virginia a couple weeks ago, and it wasn't until I really did that it really struck home that it's not a given that there's going to be mask wearing in every grocery store. Like, if you see someone in Charlottesville without a mask on here, it is scandalous. Like, in a public place, it's outrageous. You just don't see it. Like, I think that in the last few months, being like in my trips to the grocery store, I've seen one person with their mask down below their nose. Like, that was, and I was like, oh my God,
giving it 3-second stare. Like,
yeah. It's our culture here. It's what we do. And so, that's one of the things that could be contributing to it. Yeah. Also the local, our local county board of supervisors in the city of Charlottesville adopted, stricter regulations as far as restaurants, how many people could be in restaurants than the rest of the state. So all of these things together help.
Yeah. Mm-hmm. Hey, so Catherine, I want you to chime in too. Like, so your office, like, is there a sort of a reason for the numbers that we're seeing why this area is trending a little lower?
Yeah, I think, Jesse made some good points. And I do have to say thank you to everyone in our community who believes in COVID and the folks that are really taking this seriously, because it's a challenge. And, Charlottesville and Albemarle seem to be doing okay right now. Our localities, the surrounding 4 or 5 counties, aren't doing as great as Charlottesville and Albemarle. And there's so many different factors that go into it. We're also seeing higher rates amongst our healthcare workers locally, and not just always folks out in the community gathering and getting it from one another, but that's still happening. I think, Jesse mentioned the local ordinances are certainly a big assistance for us. We also have a lot of mask complaints still going through. We have a public database where people can submit complaints, whether it be anonymous or they can call us. They can include their information. And we have received thousands of complaints about COVID executive order violations and local ordinance violations. And so I think our health department, I don't want to toot our own horns, but I have to say, we follow up on almost every single complaint. And whether it's a restaurant complaint, and if it's factual or not, we still call the manager or the general manager and we talk to them and say, hey, this is the complaint we received, even if it wasn't during business hours, because we have received some complaints where people are saying something about a restaurant and the restaurant wasn't even open during that time. So whether they're all factual or not, we follow up on everything and are making sure that the community is very aware. So I think, people are doing their due diligence here, making sure that everybody's following the rules, which is a nice thing to see. We don't want, to turn into being tattles, but we appreciate when people are helping us at the health department to recognize where there are flaws in the community and what we can do to help address that and make it better.
Yeah. Now, Catherine, while you're on it too, go ahead and update us to the state mandates, because so from the state level, are you guys seeing it as an actual resurgence or that it really never left? And what's the thought behind the new state mandated restrictions?
That's a great question. So COVID never left, that it's been here the whole time. Yeah. Our community, as Jesse has pointed out too, is that we're doing fairly well in this area. I do always have to give a caveat that, we look at this percent positivity rate and how we use that to wage what our status is right now on COVID. And University of Virginia has conducted so many COVID tests that has skewed our data on our percent positivity rate pretty significantly. So we still have a lot of cases in our community, but we don't have as many as there are in Southwest Virginia or on the Eastern Shore right now. So we are doing better than the rest of the state in terms, but we're really worried about the winter. So that's where the executive orders have recently come in place, and the governor has put new restrictions in place for limiting capacity of social gatherings, which without being too political, this I think will help our community because we have seen cases and outbreaks occurring amongst social gatherings, whether it be smaller or larger social gatherings, funerals, weddings, etc. And so having this type of ordinance in place where it's limiting to 25 people will hopefully help us as we head into the holidays. But of course, it's not as fun. I mean, we want to all gather with our loved ones for the holidays, but it's just going to be dangerous and unfortunate this year that's not the recommendation. Yeah.
What about
Catherine, I actually wanted to ask you, sorry, is it all right?
Yeah, you good. Go ahead, Jess.
Yeah, I was listening to a talk that Dr. Anthony Fauci gave to the University of Virginia this last week. And he said something that was really striking to me. He said that from their national data, what they're seeing is that the majority of the COVID spread happening, especially in areas where it's spiking really hard, seems to be happening at innocent, small family dinners when it's cold and you're getting together with just, with people that are not living with you, but they're not huge groups. You're just getting together for dinner, for example, a Thanksgiving dinner. And he said that that's actually where he is seeing as being the main spread. Is that what we're seeing here too?
Yeah, we're seeing a mix of that. So here we're having large gatherings like weddings or funerals, but also small gatherings. Yeah, where people think, you're seeing your loved ones. It's your parents. What's the big deal about going to see your parents? But the big deal is that you live in two different households and your bubble is separate from their bubble. And there's a great, if you picture a Venn diagram, it's you're coming together in the middle, but you have those two outside bubbles on who you're also reaching out to. And so, yes, it is certainly spreading from small gatherings, and that's where we're concerned about Thanksgiving and Hanukkah and Christmas and all of the great holidays that are coming up that are so embedded in our loved ones and our family gatherings. And this year, it has to be different.
They're trying to keep us from a mama's razor.
Yeah, but didn't they?
I don't know about that.
I don't want to be. This is a small sacrifice compared to.
I'm a mama's boy, Max. So I don't know about this.
You'll be all right. I promise.
No,
listen, I'm not having Thanksgiving with my family this year, and they all live in the area, and it's hard. I mean, it's so hard.
But Aaron, up the street and Coffeewood a little bit. What did it look like?
Well, I think they were. I think Razor probably heard about this. That Coffeewofined had a major outbreak, and they actually had an inmate that.
The skilled nursing facilities and correctional facilities take it.
It's been rough, and definitely increase in cases, and actually there's a new testing facility in Culpeper. So hopefully that'll help people to get tested, get it done as quickly as possible. But I was actually getting my oil changed the other day, and the lady at the front desk actually said that she had contracted COVID and recovered from it. But one of the things that, and this was maybe in March, but one of the things she talked about was her lack of ability to even get air now, recovery periods, low energy. And I found it very interesting that that's not talked about a lot. I think Razor actually just posted something earlier about someone saying it's a 98% survival rate. Yeah. The problem I have with that is that I need the doctors and the people that can correct me if I'm wrong. A large portion of this country would be classified as having underlying conditions,
right?
Obesity,
right? Diabetes,
and diabetes. So when somebody says that, I always push back on it, like, wait a minute, you might be considered obese yourself. So what? You're just walking around here like you're Superman. How come we're not hearing more about some of the issues that people are having, even if they're recovering after they get COVID? Because for me, that makes me take it seriously, because it's not just, oh, hey, I'm recovering from COVID and everything is good. Yeah. There's been a lot of studies showing that people continue to have respiratory issues and can possibly contract it again. If Catherine could talk a little bit about that, I'd appreciate it.
That's a great point. You guys are on it today. So I think the long-term effects of COVID are so unknown. That's the challenge right there. But it's been here long enough now. It's been, over 9 months. Oh, that's a terrible thought. Yeah, it's been a long year for us. But it's been here for long enough that we have seen some of these long-term effects. There have been cases of people getting it again. That is possible. It's unclear how possible it is. Does it depend on how severe their first case was, how long they had symptoms? Do they still have antibodies? So that's kind of up in the air, but we know people across the country and across the world have contracted it twice if they got it in the spring and this fall. And the long-term effects are really, we've heard a variety of things, everything from continued chest pain to reoccurring headaches to respiratory problems, and down to physical changes in our physical appearance, and that people are having hair loss or conjunctivitis, which is pink eye, reoccurring. So there are many different factors and many different, long-term effects that we don't know everything just yet. And these are all of more, in the science world, this is a short-term effect, quote unquote. Long-term effect is, what is it going to do 10, 15 years from now when people had it when they were 20 years old? How is it going to affect them when they're 35 or 40 or when they become 80 years old? Are they still going to have problems at that point? And we just don't know yet. And that's my thought is, I'm encouraging folks in the community, don't be the one to find out. You don't want to find out what the long-term effect is. Yeah.
Hey, Catherine, hold on, real quick,
we
Charles.
all find out if it becomes endemic. So,
yep, true.
I have a friend who had a heart attack. She top physical condition, early 30s. COVID in February, heart attack 2 months later while resuming exercise.
Oh man.
So, that's just that's the one that struck closest to home for me, because this is somebody I know who is in top physical condition. Yes. And didn't know, tried to get back to normal and was redlining hard and had a heart attack. So, I think people, let's be safe, and also not to be the Grim Reaper, but we had the happy story about the stats, but you got to also ask questions about the University of Virginia and how they're reporting and how they're going to continue to report. For all the work that Catherine does and that the health department does, all of us are very reliant on the university and its systems. And Ruth Servan's story in our paper showed that they were very conscious about how they were going to message and how they were going to gather data in order to message very early on. So it's not accidental what comes out, how and when. And then the Daily Progress story last week with Brian McKenzie about the infection at the hospital and the exposure of staff there. The exposure of staff there shows how quickly something like that can go through one of our main systems if things go wrong. So, let's not be too cheery about this as much as.
For sure. Stay vigilant.
Hey, one thing I'd like to say before Catherine speaks is that even though this affects what I do and make money, y'all have to make sure that y'all stay on top of these restaurants and these convenience stores and not let the money aspect push it. Because I know personally, I hate to call it out like this, the 7-Eleven down there in Culpeper has self-serve food. So that means everybody. Yeah,
that makes me nervous.
That is See, that's what I'm saying. So I guess this is my first time snitching, but
I don't believe that one.
Didn't you try to snitch on Albemarle?
No, I'm trying to tell you. But think about it though. Think about all the people that come through a 7-Eleven.
No, I feel you.
They have self-serve. Who passed that?
Yeah.
Razor, I just drove past Wood Grill and the lot was full.
Yeah, I
don't understand
stores.
Let's just be real.
But at least Wood Grill has a bathroom that somebody might have to pee and wash their hands. 7-Eleven, they ain't doing that at all.
Yeah. Miss Max?
I was just saying, I walked into some pretty affluent stores too that have salad bars, and still the food is just sitting there wide open. Now, granted, they have gloves there that you to use while you pack your plate or what. Still, not everyone uses a glove when they get their food. But also, Catherine, to kind of piggyback what Giles was just saying, I was going to bring the question back to our healthcare workers, because obviously their health and safety is just as important as the public's. And so I believe you said that the numbers have risen in healthcare workers. And I'm just wondering, what do the numbers look like in terms of recovery or, loss of life, or what's happening there?
Good points. It's hard for us to know everything right now for healthcare workers. And I will say, I don't have all those numbers off the top of my head, but I know, it's really hard for healthcare workers. I mean, the status of them going back to work when they are diagnosed positive with COVID, I mean, that's happening because we have a critical infrastructure where people have to be working, and healthcare workers have different guidelines for what qualifies if they have to quarantine versus if they can come back to work, and totally different protocols. So they're wearing N95s and they're fully suited up on all the appropriate PPE, personal protective equipment, if and when they're ever working with someone who has COVID. What becomes a challenge is when multiple people in a unit are exposed, they have to still go to work. We still have to treat everybody in that unit, or we still have to be able to provide services in the long-term care facility. And we've worked with facilities and tried to assist with finding other staff that can help. But I mean, there's only so many staff. And there's a burnout. People are tired, and the immense pressure and the emotional burden that is coming from COVID on the healthcare system is outstanding. And this is really going to impact the healthcare field for decades from here. I mean, it's going to impact public health. We see that on my side of things, but I'm not in direct patient care. Folks who are in direct patient care are really, really feeling the burden of this pandemic. And that's where we're worried about it. And they're exposed much more often than the general public, who's able to stay home and only has to leave their house to go to the grocery store.
That's right. I know exactly what you mean.
Yes.
Hey, Catherine, so I'm sorry, you want to go ahead?
Oh, no, I was just going to say, so we have seen, a somewhat of a little bit of an increase. It kind of fluctuates on where we go up and down for healthcare workers, but we've got a great structure in place and a great response. And, speaking of UVA, we work so closely with the hospital and their medical teams that we're in support, and they have great plans in place to make sure that we can continue to offer essential services during COVID.
Good. And Catherine, so we have to wrap up, but can't let you go without talking vaccines. Like, you got to at least give us an update on where the state stands with the sanctity of the vaccines. And Razor, if
I don't trust it, so I'm gonna listen.
If they say you own culinary food company, you got to get it, brother, or you got to get out of Virginia.
I'll be out there raking leaves.
Catherine, tell us what's up with the vaccines.
Yeah. So first, I will say the vaccine, I'm sure everybody's heard in the news, there's 2 different types of vaccine. We don't know when we're going to get it or which vaccine we're going to get. We know that when we do get the vaccine, the priority will be for our high-risk healthcare workers, those who are working with COVID patients, long-term care facilities, high-risk patients, et cetera. So it will be going to those folks first, and then it will likely go down the line to our frontline workers, who are the next round of people who are putting themselves at risk, who are the people working at grocery stores. There's different frontline workers, as we've all learned, teachers. I mean, there's these new terms that have come up during the pandemic, and frontline is one of those. But I do want to give this cautiously optimistic feeling for the vaccine. I know people feel like it's been rushed, and yes, of course, it's somewhat rushed, but they have built the research for this COVID vaccine on the research that there has been done on SARS and MERS, other coronaviruses, over the past few decades. So this isn't, this particular strain of coronavirus that we're experiencing in this pandemic is new to us, but coronaviruses as a whole are not new to us. We understand those, and so we have to learn how to adjust that vaccine that we have for SARS and other things to, the research for those, and tailoring it to this new vaccine and this specific disease. So stay tuned. We at the health department are already working, around the clock on plans for how we will distribute the vaccine in the community. I will be hosting some, and I'll follow up with y'all on this, some informal listening sessions with community members come January and February to gather people's feedback on, what are your concerns? Would you get the vaccine? Why or why not? And to figure out what kind of education and information we should be putting out into our community. And also, people should know it's a choice. You don't have to get it. We will not be mandating that people get the COVID vaccine. It's going to be highly recommended. It's going to be helpful. But as far as I know right now, we don't have intentions of mandating that, because that's a very fine line to walk there. But we will be encouraging that folks get the vaccine and make sure, we want people to have all the information to make an educated choice.
Hey, and real quick, thank you, Catherine. But I would want to add one thing. I'm not sure that people saw this, but Ben Carson came out and said that he got COVID and he recovered from it. But now one of the things that's coming out is that he stated that that cocktail that he received that Trump and everybody else was getting has helped people recover a little bit faster. And finally, American citizens are saying, well, if you guys can get this, what's going on with getting this on the public market? So these are the questions that people need to be asking. Finally, we're seeing some logic out of human beings. So I just wanted to add that, too.
I'm going to use some logic, too. If y'all want me to take it, I'm going to be right in the midst of all the congressmen, the really rich white people, all that. I'm going to blend right up in there.
Absolutely.
Yes, sir.
Thank you as always, Catherine and Jesse, Seville, Tamara team. Man, love having you guys as partners. Ms. Max?
Of course.
I got you.
Yeah, and stay safe, y'all. I know it's going to be a challenging winter and very isolating, so stay socially connected. I love chatting with y'all today, and I know your show is important for everyone in the community to hear from each other. Thank you.
Thanks for your work.
Thank you.
Yeah, thank you. Appreciate it.
Thank you to all of our public health workers and our hospital workers and our frontline staff for keeping our community safe.